and thank you so much for joining me. I'm Jayney Goddard, President of the Complementary Medical Association, and in today's CMA approved supplier showcase video, I'm joined by CEO of CiiTECH, Clifton Flack. Clifton, welcome. Thank you so much for joining me today.
Thank you for having me. Thank you.
Oh, it's an absolute pleasure. So, Clifton, can I throw everything over to you and ask you a little bit about your work? So, first of all, Clifton, please could you explain who is CiiTECH and why is your work so important?
Sure. So, CiiTECH is a cannabis healthcare company. I founded the company almost 5 years ago now. And it's really, understanding the potential of cannabis as a healthcare product and what was happening around the world, this movement towards both medical cannabis and CBD. What I saw 5 years ago was that the depth of regulation that's preventing kind of this widespread mass use of medical cannabis is a problem, because we know how powerful it can be, how strong it can be in people's lives. So what I saw was there's an opportunity here to really help people and to build a business based on the health and wellness sector. And that's where CBD comes in. So the idea was to build a company that could service customers now to help them get their health back on track. And then as and when the regulation allows, then we'll add other compounds like THC. We'd move around different regulatory frameworks. But again, it's all about providing a kind of a alternative or complementary medicine through this kind of cannabis healthcare umbrella.
Yes, and such an important product range that you have. We're going to come on to that a little bit later. But first of all, I know that you recently changed the company slogan from inspiring science over to cannabis healthcare. What provoked that? Why did you do that?
Well, look, I say CiiTECH was founded 5 years ago. Things change. When we founded the company, certainly focusing on launching CBD products, there was a perception that the CBD is not as powerful or as useful or as efficacious as THC. So really, it's very important for us to position the company as a serious healthcare company. And we've been investing in clinical studies from day one. We've invested in cannabis for asthma studies and cannabis for fatty liver disease and obesity and diabetes. So we really have been very deeply involved in that kind of unraveling and revealing kind of the benefits of cannabis. That was back then. Things have changed. Obviously, the education is out there a lot more now. People understand the different types of cannabis there is. So cannabis healthcare for us now, it really signifies who we are, what channels of healthcare we're looking at, or more importantly, that one channel which is not on our radar, which is recreational cannabis. So everything from CBD as a food supplement, CBD as a topical, as a cosmetic, and then also medical cannabis, THC, being prescribed, which are actually now rolling out into Israel, and we expect later in the year, probably Q4 2022, we should have our first THC product in England being prescribed. So we're very excited about that. So really, it's about anything's healthcare that's not recreational.
I think it's fantastic, because the thing is that, I know so many of us in the complementary medical, integrative medical sector understand just how powerful these medicines, these plant medicines are, genuinely. And we've all seen the stories, and we know just how they've impacted people's lives so incredibly positively. So this is one of the reasons, you mentioned your commitment to research and so on. It's one of the reasons why here at the CMA we sat up, when you made contact with us, we sat up, we were so excited to deal with you because of the commitment that you have, not just to getting your products to market, which of course is important, but also really backing everything up with research. And I think that is just superb. And so absolutely hats off to everything, to you and everything that you and your team are doing there. So for those who don't know, though, for those who are new to CBD and cannabis and even THC containing products, can you tell me a little bit about how those products can actually benefit those of us working in the field of complementary medicine?
I think CBD is, if it could have been made for that sector, then it'll be made for that sector. Look, unfortunately, CBD is not being prescribed en masse. I mean, there's a pharmaceutical version, but that's very limited. Whereas the medical cannabis is being prescribed. So you have that on the medical side, you've got doctors and indeed pharmacists who are able to recommend, suggest, and they know how to prescribe and how to use cannabis. CBD doesn't have that. And fortunately or unfortunately, I believe that actually scientifically, we know that CBD is the most powerful compound in the plant. And I know this because when I speak to pharmacists and doctors and they ask me, what is CBD? I say very simple, it's nature's anti-inflammatory. Now, as soon as you understand that, well, the whole human body, we're all about inflammation. 95% of all human disease begins with or presents as inflammation. So CBD really is very powerful, but it's not being prescribed. So really the complementary and kind of integrated medicine sector is exactly where it should be, where people can see the research, because it's all out there on the internet. Our website also, all the research is there, so the benefits it has, the things that it can treat, things it can help with. So really it is people like you and your community that are best placed to advise and to kind of share the information and that knowledge with people out there. I think it's very, very important.
Yes, absolutely. And I think that something that is really wonderful that you've done and really remarkable is that you've set up the CiiTECH Academy. Can you tell us a little bit about it? Because I know that our viewers are going to be really, really interested. So that would be a lovely place to introduce CiiTECH Academy.
Absolutely. So again, when we founded CiiTECH 5 years ago, there was not much education out there. Not many people knew what CBD or even cannabis was about. So we were very quick to not just invest in research and to promote that kind of side of the sector, but also to provide information. And on our website from the beginning, we've had dozens and dozens of pages referring to hundreds of clinical studies that can show what it can do. So we've always been about educating the market, educating the users, but also educating the pharmacists and the other complementary doctors or health practitioners that are out there. What we saw was, as the industry has grown and CBD has really found its place as a food supplement or as a topical, as a cosmetic, the education has been left behind. So we felt that it was during COVID year, during the second half of 2020, that we took a view, now's the time to put the information that we have, the information that's out there, to package it up so that we can help people to share that with the world, so that people know how to present CBD, what's the best case of using it, what kind of dosage is good, but more than that, where it came from. People don't realize that people have been using cannabis in the healthcare environment for thousands of years. The ancient Egyptians used cannabis to treat wounds. They used to pack it on and wrap. I think lots of mummies have been found with cannabis wound dressings on them. So it's been around for many, many years. And we include that information in the academy. So it's about a 17-hour course. And you can do it a bit quicker if you're quick, but it's meant to be a 17-hour course. And at the end, you receive a certificate. And you really have been exposed to, and there's quizzes throughout each module. So before you pass that module, you should pass that quiz. So really by the end of it, you should have a very good rounded knowledge of what cannabis is and what it can do for you.
Yes, I think that is absolutely fantastic. It's hugely important, and I know that our viewers will be really interested. So for those of you who are watching this on YouTube, for example, there's a little button, sort of a little down arrow, just at the very base of underneath this video. If you click on that, it'll open up the show notes, and there you'll be able to see not just the CiiTECH website details and Clifton's contact details and so on, but also you'll be able to access a link to the CiiTECH Academy, which I think is really important. I do suggest everybody jumps on the opportunity of learning much more about this really extremely important medicine. I think it does us so much good as practitioners because it gives us yet another massively important string to our therapeutic bows, but also, of course, is hugely beneficial to our patients. But of course, we also need to know how to use these things. And of course, that's what you're doing, isn't it? So within CiiTECH, Clifton. Absolutely.
Well, it's all about supporting the industry. Now, if we can't help you, then you can't help your patients. So if we've got the knowledge, then we have to share that with you. We have to make it accessible for you and then for your patients. So absolutely, that's what we're about. The more we can support you and your community, the better we all are.
Yeah, I couldn't agree more. No, absolutely. I think that's so exciting. So what we'll do here, Clifton, is we will leave it just for the time being because for everybody viewing, I just want to let you know that we're going to be taking a further deeper dive into Clifton's work in the next video that you'll find coming up next week. So we shall say goodbye for now. So thank you so much for joining us. As I say, under the video, you'll see all of the show notes. And Clifton, I just have to thank you. You've been absolutely brilliant and really informative. Thank you so much.
Thank you very much. Thank you, Jayney.